Maria Holder Diabetes Center.
Diabetes doubles your risk of heart disease. Know your numbers today.
And with that caution from General Manager Marsha White, we welcome you to 15 Diabetic Friendly Minutes on VOB, being brought to you with the compliments of the Barbados Diabetes Foundation.
Nobody want to hear you. They wants to hear what Dr. Buffett talking about today.
What are you talking about today, Dr. D?
I'm going to go on to heart disease, but I'm going to talk about hypertensive heart disease since we're talking about high blood pressure.
Another informative presentation this morning to help you reduce your blood pressure.
That's good, cause my pressure won't reducing.
Are you a Saturday putting in salsa? Are you one of those people that like putting in salsa on Saturday and feel like this lady?
How could something as good as putting in salsa be bad for you?
Dietitian Victoria Cos got the answer for you coming up in this show.
I was gonna just put in my pudding and sauce order, but I can really hear what Victoria gotta say.
All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that helps you achieve your financial dreams in September and every month of the year. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money, but members get 10% off.
Good morning, VOB peoples! This is Peter Boyce here, dropping into your Saturday morning with another engaging and informative health radio show, reminding you all about the Maria Holder Diabetes Center.
Where can I find it?
You can find it in Warren, St. Michael, behind Eunice Gibson Polyclinic. Diabetics are welcome, pre-diabetics are welcome, and persons who might not be diabetic but would like to just get their health checks, they are welcome too.
And what can I find at the Maria Holder Diabetes Center?
You can find eye screening for diabetic retinopathy. Remember, once every year, once you are diabetic, you should be getting your eyes screened, not once in a blue moon or in a red moon, every single year. You can also find podiatrist Louise Robinson, because once you are diabetic, those eyes that you're screening once a year, you should be keeping your eyes on your feet and taking those feet to Louise Robinson. But you might want to know how often a diabetic should be going to a podiatrist. You can answer that question, Louise?
Well, it depends on the person. So there's different risks. So we call it low, medium and high. So somebody who's a low risk they can feel the feet, there's no numbness, they've got all their digits on the end of the toes, their sugar levels are under control, they're quite mobile and they're fit. So they'll be considered as low risk, but then we'll move up to a medium risk where they might lose the sensations or the toes might be slightly deformed or retracted. So that's when the toes then become under fire when they're walking. So when they're walking, they're not walking on the balls of the feet, they're walking and hitting the toes. And when somebody's had an ulcer, that becomes a medium risk. But high risk is when you've already lost a limb, you're at risk of losing another one or going further up the leg. You've got no sensations, you've got diabetic neuropathy, your sugar levels are out of control, your blood pressure's out of control, body continence, that's gone. They should be seeing us every 3 months. Medium risk every 6 months and low risk every 12 months. Those are the guidelines, but it saves lives. It will save if people just stick to those quick checks. Don't take long. You know, we can do the assessments very quickly, but we can tell a lot in that short time of how your disease is progressing, and people need to start checking in and putting money aside to come and have the feet checked.
You hear that? Put money aside to get your feet checked. to get your eyes screened. And remember, at the Maria Holder Diabetes Center, BART members get 10% off. But you know, another way of saving money is to cut down on your Saturday pudding and sauce. Yeah, I hear some people out there not happy about that. So take a listen to this. It might make you think twice about that pudding and sauce that you're planning to eat later.
Hello, the Maria Holder Diabetes Center radio show. I have a question for nutritionist Victoria Cox. I love my pudding and sauce. I don't feel it's Saturday unless it's a let my sauce from my favorite sauce lady. So Miss Cox, my question is, how could something as good as pudding and sauce be bad for you? And what do I have to watch out for if I is a diabetic?
When it comes to foods like pudding and sauce, again, I understand that we have these, cultural meals that we really like to enjoy, but of course, not all of our cultural meals are necessarily the healthiest. So with something like pudding and sauce, from an overall health perspective, the pudding could be, particularly fatty cuts of pork, so high in saturated fat. It's not necessarily great for our, cholesterol and cardiovascular health. I'd also be pondering about the sodium or salt level in the cooking. As far as individuals living with diabetes, the sweet potato pudding is where the starch and natural sugars are going to be coming into play, and that's what's going to be dictating, how high someone's blood sugar is going to go. So as far as still wanting to enjoy something like pudding and sauce, I would at least, in the very least, suggest trying to have lean sauce and controlling the portion of pudding.
Alright, I hear you, Victoria. I got put my pudding and sauce order now. I order in lean sauce, and I want a smaller portion of pudding. I is eating in moderation. And what's I reading? We going to be Saturday song of the day. This is a soul song from Quapova with Captain Sawyer. The girls want sauce. Compliments, the Maria Holder Diabetes Center and Republic Bank.
The good old Bajan sauce.
Jamaicans, jerky. Bajans, work it. Lucians, round it. Trinis, double it. Jamaicans, jerky. Bajans, work it. What you talking about?
The good old Bajan sauce.
When they make a sauce, I don't make a sport. I don't only use proper pork. The sauce that be boiling, bristle be shining, but the black pudding just got that tantalizing on the same mal. Licky.
We want sauce.
Wanting to enjoy something like pudding and sauce, I would at least, in the very least, suggest trying to have lean sauce and controlling the portion of pudding.
The Maria Holder Diabetes Center.
She left me so boiling, what's the crystal shining, but the black pudding just got she tantalizing and the same mal. Licky.
We want sauce.
Now our friends are here. The girls might want sauce, but I want to hear Dr. Diane Bradford, and I hear she at. Last week the doctor talked about cardiovascular risk and high blood pressure. Well, this week the doctor is focusing on the impact on your heart. So let me hear Dr. D.
I'm going to go on to heart disease, but I'm going to talk about hypertensive heart disease since we're talking about high blood pressure. So with hypertensive heart disease, basically what that means is that the blood pressure is high, the heart muscle is squeezing and working harder over a period of time to pump the blood around the body against this high pressure. And what happens, I'm going to break it down into stages for you. Try not to get too complex, but I like to share facts. So a muscle that's squeezing hard and working hard is going to get thicker. But what happens to the heart muscle? So you get some thickening of the heart muscle, and so therefore you can get some what we call left ventricular hypertrophy or enlargement in the muscle on the left side of the heart, the lower chamber, that squeezes it to the rest of the body. And that's probably one of the earlier things that we see. And when the muscle is thick, the muscle isn't able to relax properly. And how the heart works, the muscle has to be able to squeeze properly but then relax so the heart can fill up with blood. Okay, so you may get impaired relaxation relaxation of the heart muscle, alright? And then as the heart muscle works harder and harder over time, what happens is the heart muscle is like, I'm done with this. And the heart then decides, actually, I can't squeeze as much blood. And that's when you move into the phase where you start to have what we call heart failure with kind of reduced pushing of the blood or reduced ejection fraction. So those are the main two types: heart failure with what we call preserved heart squeezing or preserved ejection fraction, and heart failure reduced ejection fraction. I'm not going to get more complex because that's already complex. And so what happens is like a plumbing system. If your heart's not squeezing properly, what happens is you get fluid backing up behind the heart, which means you might get more fluid in the vessels of the lungs. The fluid in the vessels in the lungs can then seep out into where the air should be, and you can get problems with breathing. So you might get a little bit of what we call pulmonary edema. Pulmonary edema just means water in the lung tissue where the air is supposed to be. You might also see with this backing up process, you may get more congestion of blood in the liver because it's not moving through quickly enough, and you can get enlargement of the liver. You can get swelling of the legs. So these are the common things really that you think about if high blood pressure is affecting your heart. You think, am I getting more tired? Am I getting more short of breath? Am I experiencing swelling, in the body? High blood pressure does injure and damage the eyes. It increases the risk of stroke, obviously. And of course, it is the leading cause of kidney damage, followed very closely and often rivaling diabetes as the number one cause of kidney damage. So your blood pressure is not to be ignored. You should have controlled blood pressure, all of us at all ages. And please invest in a home blood pressure machine for the family, or it can be even, a slightly more remote space, but or have a source or have some way of checking your blood pressure. If you have any issues with high blood pressure or diabetes, and especially if you have diabetes and you're living with blood pressure that's difficult to control, please reach out to your healthcare provider. It is imperative that your blood pressure remain controlled. So I guess we can let's call it a happy Heart Saturday. Go out there, take care of yourself, have fun, but remember, you have to take care of your health. This is the one body that you do have that's going to take you throughout this lifetime. Take good care of yourselves, and thanks for joining me, and thanks for joining the Diabetes Center again on a Saturday. And I can't forget Alfonso, because if I forget Alfonso, I'm in trouble. Bye-bye.
You know, Dr. D, you can't forget me. Thank you again for that information you just gave. I found it to be very informative. I look forward to hearing more from you next week.
Just about a couple months ago, Diabetes Foundation, they had called me, Dr. Rapid, send the message that they were doing the eye screening program, and I went and I had my eyes done. Both me and my fiance. And I can say that I was well satisfied with the result. Right now, the cataract is under control. I would say yes, that is very good. It's very good for diabetic.
In 2025, the Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening, vascular screening, and podiatry services, offers a standard of diabetic services that equals or surpasses any you might receive internationally at a price that everyone can afford. So if you are diabetic or pre-diabetic and listening to VOB right now, call and make an appointment to get your eye screened for diabetic retinopathy by calling 243-3937. Or if you are having vascular or circulation issues or need to see a podiatrist or nutritionist, call 417-0305. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center. Until next time.
Half of people living with diabetes don't even know it. Get screened, know your numbers.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $100.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come
Holder Diabetes Center.